In this lesson, we'll take a look at the external structures of the female reproductive system and the breast tissue, female breast. So there's a number of structures on the outside of the female reproductive system. I listed here external structures, but a lot of times, even in clinical medicine, they call this the vulva. You may hear the term pudendum. Those all represent external structures. So the first one is known as the mons pubis. Just in front of the pubic bone, there's more of a deposition of adipose tissue. That raised area is known as the mons pubis. It's typically covered by a coarse pubic hair. I'll show you a picture in a moment. Let me describe these two structures also, and then they're all on the same picture. The labia majora, these are folds of skin. They contain adipose tissue and even some apocrine sudoriferous glands, which are sweat glands, right? So they contain some apocrine sweat glands. This tissue is actually homologous to the scrotum, right? So embryologically, it comes from the same tissue. The labia majora kind of close together and seal or protect the opening to the vaginal canal and the urethra, that type of thing. Right, so the labia majora are similar to the scrotum. And then within the labia majora are the labia minora. These are smaller folds of skin. There are no pubic hair there. It doesn't have any adipose or sudoriferous glands. This is going to be the labia minora. So if we go to this picture here, you can see the mons pubis would be up above right here. Then this fold here would be the labia majora, right? We can see it over here too. And again, these two labia majora come together to protect this whole inner area. This fold of skin right here is the labia minora. If you notice, again, no pubic hair, it's thinner. That's going to be the labia minora. In a minute, we're going to describe something known as the vestibule. That's the space between the labia minora on the right here, and this would be the labia minora on the left. Again, we're looking at the patient's left, patient's right. Just to kind of give you an idea from the sagittal view, all of this adipose tissue here would be in the mons pubis. This would be the labia majora, labia minora. You can see our book calls it a little bit different, labia majus, labia minus. It's all the same thing. Okay, so those are going to be the first three structures. The clitoris, this is similar to the penis in the male, right? Similar to the glans penis. It's actually erectile tissue also, just like in the male. So this is erectile tissue containing two erectile bodies known as the corpora cavernosa. If we look at it here, this is the part of the clitoris that is exposed. We actually call that the glans clitoris. Just like the male, right? Remember the glans penis was covered by the foreskin or the prepuce, right? This would be the prepuce right over here. It's going to be the prepuce. Okay. You can ignore that. I spelled that wrong. That should be a C. You can change that in your notes. Sorry about that. All right, this is going to be the prepuce. It covers the body of the clitoris. So it's the same as the male prepuce. Again, the exposed portion of the clitoris is actually known as the glans. The clitoris extends into the female pelvis. So we go to this picture here, we can see the clitoris right here. This would be the exposed part, but look how it kind of goes back into the female pelvis towards the pubic bone back there. Right, this is not visible, but that's all erectile tissue that we're talking about. Okay, so I had mentioned a second ago the vestibule is the region, that area between the labia minora. It contains the hymen. That's a protective covering over the vaginal entrance. It contains the vaginal orifice if the hymen is not there. It contains the opening to the urethra in the female, and we're going to see a number of glands. So the vaginal orifice is just the opening to the vagina. If we go back over here, this would be the vaginal orifice right here. Sometimes they call this the introitus, right? So that would just be the vaginal entrance. Let's see what we have next. The urethral orifice is located anterior. So just to kind of go back and forth a little bit, here's the vaginal. This is going to be the urethral opening here, right? That's going to be the urethral opening. Now, there are some glands that actually open up into the urethra, right, the very distal part of the urethra. They're actually homologous to the male prostate gland, and they will put a little bit of fluid, kind of a mucus type of fluid, into the wall of the urethra. I'm sorry, into the opening of the urethra, the distal part of the urethra. Now, you're not going to see that here, but on this picture here, let's see if we have it. Let me go backwards for a moment right here. So watch this, guys. Here's the bladder. This is the urethra. And right here, see these little glands right at the distal part of the urethra? This would be the urethral glands or the paraurethral glands. Okay, so that's going to be kind of homologous to the prostate gland in the male. There's other glands known as the vestibular glands. There's lesser and greater vestibular glands. They kind of do the same thing. The greater vestibular glands, a lot of times in gynecology, are known as the Bartholin's glands. Sometimes the Bartholin glands will get like an infection, and the gynecologist will have to, excise that cyst and kind of clean out that gland. Sometimes that happens. So the greater vestibular gland is just like the Cowper's gland or the bulbourethral gland in the male. If you remember, the bulbourethral gland was a gland that kind of produced a alkaline, thicker secretion that wasn't part of semen. It was more about if the male had a sexual thought or there was sexual intercourse was going to happen. This prepared the urethra and also lubricated the glans penis. Well, females have the same thing. They're known as the greater vestibular or Bartholin's glands. And again, just the sexual thought, during sexual intercourse or prior to sexual intercourse, these glands are secreting this type of secretion again to neutralize the vaginal canal as far as the pH and to also lubricate the entrance of the vaginal canal. So that one here, let me have to go backwards. So this is the vaginal canal right here. Right, we can see that. Here's the fornix. Here's the posterior fornix way back here. And notice opening into the vaginal canal right there is the Bartholin's glands, right? So that's going to be the greater vestibular glands. Again, similar to the, or homologous to the Cowper's or bulbourethral gland in the male. Okay. The last part of this lesson is just the female breast tissue. So within the female breast, we have a couple different structures. The first ones are the mammary glands. These are specialized organs that are derived from the integumentary system. And within the gland, we see a number of lobes. And then each lobe has these lobules that contain the actual glandular cells. So let's take it to a picture here. So this is a section through the breast. This big cluster right here is a lobe. This is a lobe. Then the little bubbles on the lobe are known as the lobules, right? So this is where the breast milk is going to be produced. So it produces milk that's known as lactation, right? We know the milk is there to nourish the infant, and it's controlled by hormones. When we study the endocrine system, we know it's the prolactin from the anterior pituitary that regulates milk production. And the mammary glands lie in the pectoral adipose tissue. Now, from the gland, we're going to have these small ducts that leave actually from the lobules, I should say, which are the glands. There's small ducts known as mammary gland ducts. So these little ducts right here, these just little guys that are leaving the lobules, those would be the mammary gland ducts. But watch what they do. They come together to form this duct right here. Here's one coming out of the lobe. These are known as the lactiferous ducts. Okay, so these lactiferous ducts are bringing the breast milk out of the lobe. You'll notice there's also a swelling at the end of each lactiferous duct. That's known as the lactiferous sinus. Right, so just a little bit of a swelling. All right, so the mammary gland ducts, they leave the lobules, they converge to form the lactiferous duct. As I mentioned earlier, the lactiferous duct has a little bit of a swelling that's known as the sinus. And then you can see there are about 15 to 20 lactiferous ducts that open up into the nipple. So here you can see these lactiferous ducts all coming together, and they're going to open up right here. You can actually see the openings in the nipple. We'll describe that in a moment. Now, there is some structures to help suspend the breast, kind of support the breast tissue. These are very easily known as suspensory ligaments. So you can see, kind of coming from the muscle and the skin, this is going to be the suspensory ligaments coming down. Right, all of these right here, they're holding, helping to support the breast. Okay, and then finally, the last two structures are the nipple and the areolar. All right, so the nipple would be, again, where the lactiferous ducts all come together. So that, and this is where the breast milk is going to come out. That's going to be the nipple. And then this darker area here, sometimes brownish or reddish, is going to be the areolar. Okay, so that concludes this lesson on the external genitalia and the breast tissue.